Yeah, it's really, really nice.
Yeah.
Now I feel like I need somebody to actually paint me something. I have a local friend who does like really beautiful graffiti. And so
Mm-hmm.
it just like sparked in my head. I'm like,
Mm-hmm.
maybe they need to do something funky back here. Self-care
Yeah,
is
like
my job, graffiti. What's
yeah,
up?
get juicy, you know. That's what my
Yeah.
friend says about my wall. She's like, it's pretty juicy.
Oh, it's so good. And I like the
Yeah.
feminine energy about it. Like
Mm-hmm.
that is a ooh, it's good. So I
Luscious.
want to thank you for being with me today. It's Jen's birthday, everyone.
Woo!
So when you pop on, if you do see this part of the show, tell her happy birthday. And thank you so much for being willing to hop on with me on your birthday. How amazing is that? I feel lucky. I feel special.
I feel special.
Yes, you should. It's great. I'm just gonna hop onto Facebook real fast and see if I can tag you. Sometimes it lets me, sometimes it doesn't, sometimes it's annoying. Um, but how's your birthday been so far?
Well, it's been good. It's been good. Just chill.
That's great.
Not
Chill
doing
is
much.
good.
Yeah.
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 Like I said, we were at the lake and that was the point of the weekend was to chill. I'm like, I'm going to physically peel my husband away from his office, like
Mm-hmm.
forcibly, I should say. Like we are leaving the area and we are leaving. Like we cannot stay in this house because you'll just be staring at the screen once again. He's working way too hard. I said we are getting out of
Mm-hmm.
here. So chill is the operative word here.
Mm-hmm.
100%. We need to all chill. Um. Anyway, I want to thank you for being with me one more time. I'm having given couple of people a couple minutes to hop on. This is Jenn Collard Forns, and she's a physical therapist that specializes in pelvic floor health. So, in the month of Mom on Self Care is My Job, this is a really important thing to discuss for a lot of reasons. Obviously, you're going to tell us, I'm sure, it doesn't only affect mothers, but it's certainly one of the things that nobody talks about very much. And certainly one of the many things that I think mothers are not prepared for in advance. Sort of there, of course, there are many things that, as far whether it's mind, body, or soul, things that we're not really 100% prepared for when we become a mother. But I know, and I always talk about this, like the body is obviously anything that's on in the body is going to affect your mental health because it's kind of like all connected. So I just thank you for being willing to have this potentially vulnerable and, what is the word? Just an interesting conversation. It's not
Intimate or
intimate. Thank
interesting.
you.
It's personal.
Yes,
It's uh,
it
it's it's uh,
absolutely
the
is. But
the
I
the
love it. I was
womanly.
thinking,
It's the part of us that means more than just function.
yes.
Yeah, yeah.
It's so important.
Mhm.
So tell us a little bit about yourself first. I always like to start there, like, because there's inevitably always a story as to like how and why you came to practice what you practice, right?
Yep.
So
Mhm.
I would love to hear, more, talking about personal. Like I would love to hear from your end, how did you end up focusing on this and what
Mhm.
it means to you even, right?
Yeah. So I've been a PT since 1996. I went to Northeastern. I graduated from their PT program there. Shout out Boston. And for the first like 10, 12 years of my career, I focused on orthopedics and sports injuries. I did a few years in like acute rehab hospitals, like the gamut. And then when I started to think about becoming pregnant and starting a family, I thought to myself, oh, hold up, because I hear about all these things that happen to your body once you have a baby. And like, I don't want to be a number, I don't want to be a statistic. And, I knew some people that had some issues with, urinary incontinence, irritable bowel stuff, painful intercourse. And I was like, there's got to be something more than Kegels because, if we think about the rest of the body, we don't just do like when you have an ACL reconstruction or a rotator cuff injury, we don't just sit there and have a person squeeze. Like there's a whole bunch of things. Like there's behavioral modifications. There's, oh, if that hurts, then don't do that, and there's tons of exercises and relaxation, like you massage, you stretch, you move, you learn different things about your body. So, in thinking about becoming a mom, I wanted to prepare my body for what I had ahead. Because just like if you were going to go run a marathon, you would start training, right? So, and I was pretty fit then. I'm relatively fit now, but I was
I'd say so, yeah.
super able to train when I was younger with no kids. And so I started going to all these like PT continuing education classes for pregnancy and postpartum, really, selfishly to get myself prepared. So I knew what was going to be up and what could I do to prevent, this I thought was inevitable, which it's not inevitable to have these issues. So once I started seeing women prenatal and postpartum, that really opened the door because women were coming in with more than just a little bit of urinary incontinence. Because at first I thought that was going to be the main thing, and turns out that's just a small portion, a small part of pelvic floor issues, or, a lot of people will say pelvic floor issues, but it's really like a whole body system issue. It's not just what's happening in that pelvic floor. Just like, if you have a knee injury, what's happening at the hip is important. What happens at the abs is important. And even how you move and sit is important. So it's not just the pelvic floor. It's tons of things like your breathing, your abdominals, your glutes, your hips, your feet, even your jaw and your breath and the TMJ, right? And your thoughts, your feelings, your emotions. It's not just a muscle. So then after I had 3 kids, I had some issues of my own with each child's birth that I had to come back from. And I went for pelvic floor PT. And at that point, after I had my 3rd, when I went for pelvic floor PT, I was like, oh my God, like this is so important. Like I can't just like sit here knowing all the stuff that I know and not help others get better, and I was able to get better pretty quickly with very, help, like direction. And I just, I made it a goal of mine that if I could help someone else not go down that scary road alone and get some help, that was my mission.
Yes. Oh my God.
Yeah. So right now
It's
I'm
wonderful. There's
yeah.
always, like I said, there's always a story. And it's like, I've heard from a couple people having since sort of announced this episode that like there aren't that many PTs that are so super focused in this area.
Yeah.
So it's like hard to find. It's funny because even since we met, which I love, I was like reminiscing in my head today.
Yeah.
I was like, whoa, I'm like, we met through a wine tasting
Yes.
and then through yoga. And it's like, I love
Yes.
that you just,
that women's
like
circle.
there's
That
a
women's
reason.
circle we
There's
were
always
at.
a reason for these connections. I love it.
Yeah.
But also it's one of those things where, yes, having met you and having you just educate me so briefly in meeting about what you do. Now, of course, it's like when, when somebody buys a car and then you see the car everywhere, right? It's like, it's coming into my awareness constantly how many women struggle with this. Now, I'm relatively lucky. I think that I don't, I haven't experienced, the incontinence and things like that, but I cannot I can't, say I've experienced nothing. There's no doubt that every single mother is going to experience some kind of a difference in the way that their body is operating or not, or, lack thereof or whatever. And the problem is that the immediate response is like, what's wrong with me? Like something's wrong with me, like something, or I need to, like, what can I, it is good to say like, okay, what can I do to fix it in a more productive way? But the thing is that all of these things are really not discussed in advance when you're preparing to be a mother. So you think something is wrong. Meanwhile, this is such a common thing.
Yeah.
But what are the other, like, what are other ways that having it's having your pelvic floor issues or having that be something that you need to focus on, what are the other ways in which it like presents besides the incontinence that I think that most people are aware of, which of course means that you might accidentally pee yourself.
Right, right, right,
Just in
right.
case anybody's
Yeah,
listening and
yeah,
needs to hear that.
right. So no amount of urinary leakage is acceptable, first of
Right.
all, at
A.
just about any age, right? So urinary leakage is common, but it's not normal. That's like a popular saying in my field. And another thing that I see a lot of, so other ways that pelvic floor issues can manifest is what you were saying. So painful intercourse or uncomfortable intercourse, so penetration
Mm,
or not even penetration, just intimacy. So it could be something like that. So painful intercourse or painful penetration is called dysperonia. It could be something like the area of the vulva or the labia could be painful at the skin or the muscles underneath. It could be a painful scar. So if a woman had a tear or an episiotomy, that could create a source of pain, because if you think about a scar, if you had a surgery somewhere, or if you say you tore your quad or your rotator cuff, like you would have physical therapy. Like it would be unheard of for someone to like tear their quad or have a car accident and have this huge gash and not have physical therapy. That would be unheard of. But when we talk about the pelvic floor, it's like taboo almost. But they're
mm,
just muscles. Like these are muscles just like the rest of our body. They have circulation, they have nerve supply, there's lymphatic tissue there, there's skin. All the stuff that is anywhere else in the body is right there in the pelvic floor. So when there's a scar or an injury or a muscle tear that can happen from childbirth, right, that it needs to be rehabilitated. So so painful intercourse, maybe from tight muscles. Oh, a lot of women that come in with urinary incontinence, they think that their muscles are weak, and that sometimes brings in a feeling of maybe shame, or, oh, I didn't do enough Kegels, or, oh, maybe that's a sign of weakness. And it really takes a hit emotionally in our self feelings and identification. But a lot of times it's the muscles are too tight. They're like guarding like anything. And these muscles need to be relaxed. Just like if someone had a neck pain and headaches and, pain down their arm, we would do some massage. We'd be like, oh, you've got a muscle spasm. That must hurt you. Let's do something about it. So it's the same thing in the pelvis, just it's inside. And people, it's a little bit maybe uncomfortable or uncomfortable emotionally, or maybe physically sometimes too. But it's different, so people aren't used to hearing that they have all these muscles inside their pelvis, and outside their pelvis too. It's like a lot of people think that their pelvic floor is just their vagina, and it's
mm,
it's so much more than just that. So scars, right? Working on scars, helping those muscles to not be so tight. Like when you get a scar, that skin is very often sensitive to touch.
mhm,
And that might cause a little bit of a grip of fear of pain, even with like wiping for toileting. That scar is new and fresh. It might cause a little bit of guarding. And if that guarding takes on a life of its own in protection mode, then we end up with maybe a lot of muscle spasm, and that can
mm,
contribute to pain, painful intercourse. It can contribute to urinary incontinence, constipation. I see a lot of people with constipation and hard stools, and not just during pregnancy and postpartum, but really all in our lives. A lot of people have hard stools and they don't evacuate easy, and that can create like a habit, you know, of the muscles and of the behaviors. So when the muscles are tight in that pelvic floor, they may contribute to a tight outlet, right? So that it doesn't allow the stool to pass easy. Or if urination is maybe like their stream is fast and then it gets sporadic and they can't completely empty. So it could be something, pelvic floor issues could be something like incomplete emptying of a bowel or bladder. Um,
mm,
yeah, tailbone injuries, so it could be something that's not even around childbirth. It could be, you know, fall. Like I fell a gazillion times when I started snowboarding, and I've had my share of tailbone pain. So it doesn't necessarily have to be something like that. Or bicyclists, you know, with a saddle kind of pain. There's nerves in the pelvic floor, like the pudendal nerve. All these other nerves that can get compressed just from maybe sitting or doing something, straining. So there's all those kind of injuries that can happen too, and as well as a pelvic organ prolapse. And that's when something in the vagina is coming down, like the bladder is fallen low, or the uterus, cervix, or even sometimes the rectum kind of comes down into the vaginal canal. So, you know, we talk about lots of stuff. And I
Yeah.
see a lot of women with diastasis recti, and that's when the abdominal muscles separate, which is during pregnancy. So I'll say spread, maybe not separate. So during pregnancy, it's very normal. It's very normal for them to separate or spread, because the abdomen has to, you know, grow and expand to contain the little cutie pie or cutie pies in there. And our body adapts to becoming a house for them, right? So our bellies expand, our rib cage widens, our pelvic floor and our pelvis widens with all those amazing hormones that we have. So it's a lot. It's a lot. Any of those things could be something that has to do with pelvic floor, and even hip pain, back pain, SI, sacroiliac pain, pubic bone pain, all this
Yeah.
stuff. So
So
it's
well,
way more,
that's
way more.
right. I mean, that's part of it, is to acknowledge all the things that have to change in pregnancy. That, you know, I don't really think that, you know, everybody is that, you know, educated on it until it's happening to you. The fact that
Yeah,
literally everything moves out of the way and then has to, you know, find, I mean, just it's an attribution to just how freaking amazing our bodies are as women,
yeah,
first of all, because if we're lucky, that the stuff does make its way back where it needs to go.
right.
But, like, when you think about everything that needs to adjust and make way for this baby inside of you, of course it's gonna be so common for there to, even if everything gets back where it's supposed to go, is it going to feel the same? No. And
Right.
like you said, and, you know, obviously this is gonna be connected to my whole purpose of these conversations that I'm having. Like you said, is any, you know, incontinence, is any leaking acceptable? No. Right?
No.
So, like, your
Yeah.
quality of life and your happiness and your comfort in your body and your ability to have pleasurable sex and all of the
Yeah.
things, not, you know, a lack thereof of any of this, none of it should be just acceptable. But I do feel that there's a ton of that mentality that's pushed upon us in the medical field, where you'll go and there's a lot of this, like,
Yeah.
eh, you
Yeah.
know, like, this is just the way it goes. Like, I will, you know, because I'm very commonly candid on this show about my own personal experience, because how could I not be? Um, you know, like, I will definitely have uncomfortable intercourse sometimes. Like, I'll definitely have discomfort sometimes. And it took me a long, and again, I was totally in the mentality of this is just what's gonna happen.
Mm-hmm.
Meanwhile, I had 2 C-sections. Didn't have a vaginal birth. So that's another discussion of me in
Yeah.
my head thinking, well, how could I have any lasting, you know, issues if I didn't have vaginal birth? Because of course there's so much of that sort of, I don't want to say shaming, but there's like a judgment about around having C-section, not having a vaginal birth, and not having a lot of the same, therefore, complaints be valid because I
Mm-hmm.
didn't push a child out of my vagina.
Mm-hmm.
But what I learned is that the weight of, I mean, 9 months
Yeah.
plus of having all of that go on inside of you, the weight internally, it doesn't matter. I mean, obviously, that is going to itself have such an effect on your pelvic floor, just the weight
Right.
of it, not that you actually had the episiotomy or tore when giving actual, you know, vaginal birth. It doesn't matter. You're going to have so much of this, you know, could very much have a lot of the same ways that it could present. So just putting that out there, that I feel like there's just a lot of, you know, not allowing ourselves to say, oh, I might need support in this, because A, you're not really offered it willingly from maybe
Mhm.
your doctor or whatever, and it's taboo, like you said,
Yeah.
which really just, is a whole separate discussion, right? It's like, okay, so like, is that really the reason why this isn't offered as much and discussed as much? Is it really just because, like you said, it's a lot easier to discuss a rotator cuff injury without discomfort than it is to discuss a vaginal or pelvic floor injury without discomfort? Like, could that be the reason?
I don't know. I don't know if that's the reason. That's just my analogy as to why it's so important. But yeah, I'm not sure why it hasn't caught on in our countries. In other countries, it's like the norm, right? Like in
Right.
France, it's the norm to have perineal rehab after you have every single child. Um, but I think a lot of the midwives and doctors around here are starting to catch on, and I always tell myself that I remember that their main job is to keep you and a baby healthy and
Yeah.
alive. That's their number one job. So, there's a good amount of midwives and doctors that refer, consistently, and they screen their moms and they send them for PT. And there's some that just haven't come on, I don't know, come on board with it yet. But it's getting there. It's
It's
getting there.
definitely getting there, yeah.
Definitely needs to be more. I would say a lot of moms that come in are, they'll ask their provider for a PT, and their providers are like, "Of course, yeah, go. Of course, you think you need it. You're having troubles. Go right to it." So sometimes just asking for PT or just saying, "I'm not sure if this is normal, and I think I need to see a PT." That goes a long way. And sometimes all it is a call to the doctor or the midwife or whoever the provider is and says, "Hey, can you just send a referral over?" Whether it's a pregnant mom or postpartum mom or a woman in menopause, or even a woman who is not even, like young women. I've seen teenagers with with a variety of different kind of issues. So yeah, I'm hoping that it catches on
Yeah.
because
It's definitely
it's
there's
essential. It's essential.
yeah, and there's definitely we're evolving. It's getting there. I agree,
Yeah.
like
Yeah.
um but I think that it's really all comes back to, like you said, being comfortable to self-advocate and
Yes.
say like, no, I really need to address this, even if you feel like it's taboo or even if it's uncomfortable to put it
Right.
out there.
Yeah. Yeah, and like
Um
when women come in, I always like they run the room. Like it's their room. I work for them. I'm there to help them. And I always say that I'm really comfortable talking about all these things because I do it all day long. But if you're not comfortable, if the person isn't comfortable and they're not sure and they're a little afraid, which is to be expected, especially if you're having pain in an intimate area, it's a little bit scary coming in sometimes. So I always say like they run the room. I work for them, and whatever they say goes.
mm, I
But
had just
oh,
go ahead.
I just wanted to mention about the C-sections. I didn't say anything about the C-sections. So I see a lot of women with C-sections just getting, some women will have a hard time just touching the C-section and massaging the C-section, and like April was C-section Awareness Month, and
Huh,
I had
didn't know.
posted a repost from another PT about how important it is to touch the skin and the scar after it's healed and closed to get it used to sensation, because our abdominal muscles are right there, that lower tummy, and a lot of mommies come in with that complaint of the mommy pooch, right? And it's really important to start touching that skin and the scar, getting it to move, just like we would a knee surgery or anything, right? So
Yeah.
that it can normalize.
When I love when all the light bulbs go on in my
Yeah,
head
yeah,
because I did not do that, and I do not do that. And, so whatever, how old is Ollie? 2.5 years after C-section number 2, I still have very little sensation in that it's a very, centralized it's a very specific location. It's not everywhere.
yeah,
It's just but yeah, what's going on in my head now is like, oh, not only is it obviously would be important to touch it so that you it could, like you said, so that it can regain the ability to like feel. How does it, how does it relearn? How does that area relearn? But also like, I'm even thinking about it now from almost like a mind body connection perspective. You know what I'm talking about? Like
Absolutely.
how does it, how does that area of my body feel if I never touch it, if I avoid it? Like it, and how does that, manifest in other ways, type of thing. I mean, I've literally done meditation, like I've literally done body love like meditations where it's like, touch the part of your body that upsets you, or like that you haven't been connected to, or that you've been ignoring, or that you've hated. And it's like tears will come because it's just like, you know what I mean? Like, it's just like, okay, like how do you maintain that connection to your body, to your vessel, without really paying it the attention that it's due? And especially as women, like we're just like these nurturing, there's these nurturing beings, but we hold ourselves back from nurturing ourselves. So, and a lot of people think that's just simply, oh, self-love, yay, yay, yay. It's more complicated than that. I can say it, but you can literally think about it from how does it feel to touch yourself? Does it feel fucking awkward? Because if it does, it's something to think about. It really is.
Yeah, it's scary. It's scary and nauseating for a lot of women to touch their C-section scar because it has a lot of emotions wrapped in, whether you were going in and you were not expecting a C-section, or if you were going in expecting a C-section and it went well, it didn't go good. I mean, all these different things can happen, and there's a lot of emotion to that C-section scar. So more like, exactly, you said it perfectly. It's even more than just the physical nature of healing the soft tissue. It's that emotion for sure.
It's trauma in the body, which we've been, touching on in many episodes of the show. But, like even for me, for example, it would be like an emotion of regret or something like that, because almost every mom, not every mom, but me, and I know a lot of moms would go in with the expectation of having a beautiful, natural, potentially natural without drugs even, vaginal birth, just like in the water, like just like, like the photos,
Calm.
Beautiful music playing in the background, all that. Hell no, wasn't anything like that, right? I always tell,
it's not often
expectant
like
moms,
that.
it's like, let go of all expectations. But yeah, so yeah, I think it's important to note that. I would be remiss if I didn't just note one thing, especially because I know I had a comment prior about, and I like also, in order to not sort of isolate women who are not mothers out of this conversation, even though this is the month of moms, let's face it, all vagina carriers could potentially experience this. So somebody had commented about having pelvic floor issues related to endometriosis, which is an extremely common condition.
It is.
So I just wondered if you had any comments about that.
Yeah. So with endometriosis, we're treating the things that are coming along with it. Like, we're, as PTs, we're not curing the endometriosis.
No. Yeah.
So we're working on the additional things that are going on, like maybe muscle spasm, guarding, urination, helping to normalize or improve their urination and their defecation, or painful intercourse. So we might introduce them to different techniques for complete bladder emptying, for constipation, maybe using a squatty potty, or like splinting, like helping to hold up the perineum when they're going to the bathroom, breathing. We'd talk about pain management. If they're having maybe painful intercourse, we may introduce them to some manual therapy internally, externally, and internally, like using a set of like a progressive set of dilators, which are, they look like a toy, a vibrator, but it's just like a stick basically. and you progress into the size to help stretch the tissue, to help, just stretch the area. Or there's this other little tool that we give, or we have people purchase to help with massaging or mobilizing the tissue on the inside of the pelvis. Maybe doing some abdominal work, a lot of breathing. We do a lot of diaphragmatic breathing or different kinds of breathing, and talking about pain management techniques. So, those are the kind of things that we do, and we talk about what is the main issue that they're presenting with, and we do a lot of education. So sometimes people can get irritated, like their skin or their muscle can get irritated if we don't help them in the right way for that day. If we go too far or not far enough with our stretches, just like when you go to a yoga class or you work out, if you go too much, you might pay for it. And if you don't do enough, you may not progress. So things like that can happen, just like they can happen anywhere. Yeah.
I like how you're saying we just do a lot of education, because I would imagine that I would imagine something like this, you really do have to take it home with you, like you have to, it's not going to be like this, we cure you type of a situation. You have to, but that's why it's falls into this category of self-care, because it's like, you need, it's prioritizing, like we said, like your enjoyment of sex, or your just your quality of life, or your comfort in your daily life. Like we don't accept these things, because you're worth having the proper diagnosis and treatment to come to a better place with it.
Yeah.
What was it?
Oh, sorry.
No, go continue.
I was thinking that one of the things that I say often, not every session, but often, is that I'm there to facilitate them and give them things to do to help themselves. But they're the ones that are going to get themselves better. Their mind and their body working together is what is going to make them better. Like I'll help, like I show them techniques and things to do, maybe dietary wise, behavioral wise, toileting wise, talking about dilators or self-care, sleep. We talk about sleep a ton, sleep and nutrition. But they're the ones that have to do it. And that's hard. It's really hard, especially if you have a newborn at home or a newborn and a couple other kids. And, if you're staying at home with them or if you're going to work, like neither route is an easy route. And moms are pressed for time. So it's tough for them to put themselves first. And I'm always pushing and pushing, like to help them put themselves first so that they can heal themselves and then, be the leader that they are.
Yeah.
And it's hard. It's hard.
Yeah. With everything else, I'm the first one when we talk about self-care and prioritizing your wellness, I'm the first one to say it. Easier said than done.
Yeah.
It's so, because it needs to be acknowledged. We're supposed to be the support system for everyone else. So it's hard to shift into support for yourself. But that's why I have these conversations, because it's self-care is my job. Like we're the manager, we're the manager of the household, in many cases, we're the manager of the household, manager of the children, manager of the family, manager of your job. But you're also the manager of your own wellness. Nobody's going to do this. Is everybody. This is not just women, not just moms. Nobody can do it for you.
Right.
Nobody's going to do it for you. And you owe it to yourself for, exactly what we've been talking about.
Yeah. And you deserve it. We all deserve to have a healthy, pain-free body and mind. And sometimes it takes work, and we have to put ourselves first and put ourselves on our own calendar so that we can make those goals. And it's hard.
Yeah.
It's totally hard.
It's totally difficult. Easier said than done, but
Yeah.
What I also, always make sure to note is that you don't have to do it alone. It can be this behemoth, that it seems like a behemoth. It seems like to approach. And I know a lot of people get into this. Well, where do I even begin? Well, guess what? if something like a pelvic floor issue or concern or anything bodily, right, is affecting your daily contentment, start there, because I
Yeah.
bet you $1,000,000 it's affecting your mental health too.
Right.
How can we, like, how can we feel good? How can we, and then forget going even deeper and go, and enacting bigger changes in our lives. Like if you want to incorporate a workout routine, but every time you come home, your body is ailing you in some way, and then you can't get to that next level. Of course, give yourself that acknowledgement of, I gotta start with the pieces. I always just make sure to say that, because it's like, it doesn't have to be everything at once. Pick one thing that
Yeah.
needs to shift, and that's it. What was coming up for me before, speaking of taboo, because
Mm-hmm.
if it's coming up, if it's here, I gotta say it, because it might be something that somebody needs to hear.
Yeah.
Um, I find it very interesting how it's kind of this opposite thing where, say you're having the incontinence and leaking, right? The automatic assumption might be that there's a looseness
Yeah.
or a letting go already, because it's leaking. But it's
Mm-hmm.
like, it's actually the opposite. It's actually that there's an extra amount of tension.
Yeah.
And God knows, as yoga teachers, right, how much do we talk about releasing tension in the body and how important it is? Because you're
Mm-hmm. Mm-hmm.
literally holding on to potentially not just physical tension, but emotional tension that's
Yeah.
connected to some form of micro trauma or other
Yeah.
in, that happened in your world at some point. But I just find that so interesting. I'm assuming you probably have women who come in and think that it's the opposite issue, right?
Oh,
And then,
yeah.
even it's coming up for me too, like the kind of the shaming that might come in, because women are supposed to, so right, the optimal situation in that area is going to be that you're tight.
Right.
So if we feel like we're not tight and all these things are happening, the potential self-shaming that could ensue because of all of the, sort of programming that's around us as far as how we're supposed to be physically, which I feel like I come back to that so much in these
Mm-hmm.
conversations, but it has to be said.
Yeah. Yeah.
Um, you probably find that a little bit, I guess, with people. I was putting it out there to see if there
Oh,
was.
yeah, yeah, yeah. So I see it a lot. And, even if a woman comes in, say, postpartum, or a woman comes in with a prolapse, like something is coming down, they automatically think that, not all, right? But a lot of women will think that things are loose and it's not being supported. And that may be true. But those muscles can also be clenched and tight. And so if you think about a woman who might have a prolapse, you know, I would think that, and this happens a lot, is that there's a lot of guarding. Like they might be holding their bottom all of the time so that nothing falls out, right?
Mhm.
And then they might get some trigger points or muscle spasms in the pelvic floor because they're just clenching. Like you would never go around like holding your fist or squeezing your bicep all day. But we go around as women with our gut stuck pulled in, right? To maybe look a little bit thinner. Our pelvic floor is tight like anything. And there's no muscle in the body that you contract 100% all day long. Like that's just
Mm.
ridiculous. Not, I'm sorry, I don't mean to say ridiculous. But just,
It's
you
unrealistic.
unrealistic. Thank you. So squeezing those muscles all the time is not going to stop that from coming down, right? Um, and it's not always just what's happening on the floor. It can be happening above. So if a person is slouching and their ribs are coming down on their pelvis, like how much room is that in the abdominal space for all the organs? Like if our ribs are here, whoop, and our pelvic floor is here, and our organs are all in between. If we're slouching all day or holding babies all day or nursing all day, our ribs are down and we're slouched and we're tired, right? So there's a lot of pressure coming down from above. And if that pelvic floor has just given birth or is suboptimum, right? What's a woman going to do but clench? And so then you have these two factors that are like fighting each other and not helping the situation. So a tight pelvic floor, it sounds like maybe the great or the ideal thing, but all muscles, whether it's the pelvic floor or anywhere else, have to be strong and mobile, strong and flexible. They have to be able to work, and they have to be able to rest, and they have to be able to lengthen. So there's got to be like a perfect balance. It doesn't have to be perfect, but it can't be so imbalanced that one side is the dominant thing. There has to be
Right.
variations and options for movement and for speed. Like if someone's going to laugh really quick or sneeze really quick, and then they get a leak of urine, maybe those muscles are strong, but they might not just be fast. Like some people are fast runners and some people are long distance runners, and we have the same thing that can happen in our body with our muscles. So like we get what we train a lot, and in yoga, right, abhyasa. So we get what we train. And if we're training clenching, we're going to have clenching, and we're probably going to get some pain that goes along with that. So working the up and down is really important.
I love that.
Does that make
The
sense?
concept of balance, it all comes back to it. As much as it's hard to attain and hard to maintain, it is the practice, just like within yoga. It's just the practice of at least attempting to enhance what's going on, to improve, just to improve, just to practice, not to cure or master or attain perfection. It's just, offering that help to what is needed. I love that. The other thing that I was thinking about bringing up was how it might present in different age groups, right? So I would imagine, especially even, you could stay in the category of moms, right? I would imagine that there are probably moms who have had symptoms that they've just been like kind of ignoring or just living with for years, decades, perhaps.
Yeah.
So how does that work if it's been a while, without being addressed?
Well, I mean, it might take longer to get better, right? There might be some other, say, neighbors of the body that might have put up their fences or guards, right? So if maybe it started as just a little urinary incontinence, and then the muscle started squeezing a lot to protect from leakage or fear of leakage, or maybe they started to limit their hydration so that they wouldn't have to go to the bathroom all the time. So then maybe now the person is becoming dehydrated, not peeing often, their urine is maybe more acidic. Maybe they're getting constipated now, and because they've been squeezing so much, now they have painful intercourse as well as urinary incontinence and constipation. And then maybe they have a little bit of like left lower abdominal pain because of the backup of the stool, and all this stuff is happening. Sometimes I see a lot of people that come in with a lot of things, more than just one thing. And sometimes it's because of years of putting things off, and just not knowing, that something could be done about it.
That makes sense.
So sometimes people
one thing leads to another.
Thing leads to another, and sometimes people will come in with a full a gamut of issues that are going on, maybe with the pelvic floor and abdominal and health and sleep and just wellness in general. But sometimes if we just introduce like a new variation, something different into the system, that gives the whole body another option, so that it's not just doing the same thing day in and day out. If we give it more options, it takes off the load, the pressure on all these different things. So when we start, it often goes back to the breath and bringing, the parasympathetic, that rest and digest, reproduce, feeling safe, and bringing people out of that sympathetic go, fight, flight, or freeze. So bringing that down is a nice way to work on everything, really. As soon as you get that diaphragm moving with the breath, that pelvic floor starts to move with the breath. If we slow the breath down, we can bring the mind, that hypervigilant, I've got to go. If we help things come down to a little bit of a slow speed, and we get them into a more calm place, then they can feel a little bit more safe to release and let go of their pelvic floor. And that can just help massively with painful intercourse, painful scars, pooping, peeing, completely peeing. You know what I wanted to say is that this is something that I've been working on myself lately. So when I'm at work, sometimes I'll have to go to the bathroom in between patients, right? And I'll say, oh, I just have to pee real quick. I'll be right back. And I say to myself, don't say, like, what is this pee real quick? Like, we can't just sit there and pee real quick, right? Because
it's going to take as long as it's going to take.
It's going to take as long as it takes. But a lot of women will pee real quick and not fully empty their bladder because we've got kids outside the door. I mean, I can't tell you how many times I've, cut off my pee stream, right? Because my kids are going nuts outside the door, or somebody's got to go to like some practice or something. So I cut myself off, and my husband was saying, he's like, that's nuts. Like, I would never stop peeing because someone was banging at the door. And so, but I'm not the only one, right? So I'm saying this because I know I'm not the only one that pees real quick. So if we pee real quick and we don't completely empty our bladder, then we got to go soon later, or we get that residual, in the bladder that is likely just sitting there, maybe at the urethra, and when we sneeze, boom, we leak, or something like that. So I just wanted to throw that in there. That was like my mantra this whole month, like, stop saying pee real quick, Jen.
Do you say, I'm going to go empty my bladder?
I'm going to go to the restroom and completely relax and fully empty my bladder. That's what I say.
Be right back. Yeah. I mean, yeah, words are important, right? I mean, hey, if it works, it works, first of all, but it is so true. And I have at least one very close person to me in my life who experiences exactly that and has realized that that's part of the issue, in her trying to help herself through it. That, we don't empty our bladder, and it's all connected. It's coming back. Like you were saying, you brought it back to the nervous system and the go. So once again, it's like letting go, slowing down. We live in a society that just, really rewards not only the doing, but the doing it fucking fast and getting it done before the other person or whatever it is. And it's just like, no. Like we're literally causing dis-ease. And, so, and I think it's important to note. So when you're not prioritizing your wellness by way of moving too fast and not slowing down and not giving yourself that space that's so important to have things really work naturally and optimally, we're creating this disease, which also will eventually slow you down, but in a much less comfortable way. So just noting that, like how it's all coming back to this, not only the slowing down just in your daily and making sure to fully empty your bladder and everything and not doing things so quickly, but literally giving yourself even additionally the space for breath, giving you that moment, and curating for yourself a moment of time to breathe and to allow your nervous system to come back to a calm state and not into this reactionary state. And how that is often so just clearly the answer. And, that's why we have our, mindfulness practice and our presence practice. And that's why these are all buzz phrases that you hear constantly. And that, if anybody's listening and thinking, God, I'm getting tired of hearing people tell me to be mindful. But it's not just about, figure out how to appreciate what's going on right now and not think so. It's not just that. It's literally cultivating the ability to be comfortable slowing down, because it's not, as a means for wellness, not just as a means to, you're being a shithead because you're moving too fast and because you're too obsessed with the outcome and No. It's not that. It's remembering, because we completely forget how to slow down. So it's like the only way that we can remember is to cut out space and time to do it. We forget. It's okay. I forget too. So we just need to make that space, and I love how it's all connected to that. Yeah. Oh my goodness. You mentioned before Diastasis Recti. And again, another light bulb went off because I have that for sure. And I think it's, it's somewhat minimal. I think the yoga has helped, obviously, but it becomes more and more apparent, I think, because as everything else, again, I'm 2.5 years postpartum at this point, giving myself plenty of time to let my body naturally come back to whatever state it's going to be in. And everything else seems to have come back to a place that's good. But definitely my midsection is still, it protrudes, right? Like there's this, but what I do, of course, is exactly what you just said. I walk around drawing in my what the hell is it called? The rectus abdominis?
Transversus, right? Or your abs.
My front abs, I think. Right. So, and then I also was questioning myself because I think in my teaching, I think a lot, is navel to spine, sort of drawing that in. Now I wonder whether that's maybe perhaps skewed too much even on my end, whether it's like, okay, well, I do that myself as a way. I think it helps with my posture, but maybe it's like also trying to combat an issue that needs to be addressed in a different way. I just wonder.
I mean, it's possible. I mean, navel to spine is a good cue for most people, but some people who are already navel to spine 24/7, and then we cue them to pull it in even more, it might not be like the best cue for them, or like maybe just fine tuning the definition or how much. So sometimes I'll say to people, draw in your belly button 10%, or we'll go like 100% and we'll work our way out, like then 50% and then just 25. And I'll just give you a little like 10%, a little surface area, just like a little hug, and see what that does to their abdominal cavity, what that does to their posture, what that does to their breath, and see what they can do with that. And like another concept that I use a lot is how much tension do you need for the task at hand? Right? So do you need 100% grip of your ab? Like, are you picking up a refrigerator, or are you just picking up your purse? Like, and if you're just standing there, do you really need to have your abs full on? Probably not, because that's probably for some people maybe a lot of oblique work, and that might be like pulling the rib cage, high and wide, pulling the skin and muscles maybe a little bit further apart. But everybody is different. Some people will come in with the diastasis right at the belly button. Some people will come in with the widest point up near the rib cage, and some will be down near the pubic bone. So, and sometimes it's more a thing of muscle imbalance of the abdominals versus, true diastasis. And sometimes it's not diastasis at all. On some people, it's tissue that I can't help anything with. But it's all different.
Yeah, of course. It's going to be individual, of course. Yeah. I just figured I would say it because I know that, diastasis recti is another super common thing that, again, I think a lot of moms resort to just like, this is what I look like right now. And that's actually, there's something to be said about that, I think, because that's kind of where I fall into.
And I love that thought because it makes me happy when people are happy with their bodies. That's good.
Right. Yeah. Like sometimes, hey, like I said, being at the lake this weekend is like, I'm back in a bathing suit for the first time in a year. And I'm like, oh, all right. I think I went, like, I just grabbed whatever, like I'm, packing for the kids, whatever. And I just grabbed like a bathing suit that I ordered, I think probably at the end of last year, whatever. Whenever things go on clearance, that's when I get them. And I hadn't tried it on yet. So I'm like literally like standing in the lake with the kids with like a bottom on that like just barely fits. Like just but luckily there's nobody there. It's, Lake Sleepy Hollow. It's like whatever. Yeah. But I'm thinking to myself, there's always that moment when I'm like, ooh, you know, but then it's always followed by, this is my body. I had 2 kids. I am not going to sit here and shame myself because I've got the pooch. I mean, there were 2 kids in there. Let's go.
Right. Right. Exactly.
And,
Like, come
and we do
on.
it to ourselves too, because in all honesty, there's probably just, you know, for as many people that might glance my way that say, oh, what's going on there, which is probably way less than maybe perhaps even the people who are like, well, look at her looking
Yeah.
good.
Look at, she's
So
looking
it's
good.
like, you do it to yourself, most
Yeah.
likely. It does. I would be bold as even to say it doesn't even matter what the hell your body looks like, that you're probably critiquing yourself way more than anybody else is saying anything in their own head. And it sucks that we do it to ourselves, but we can just
Yeah.
become mindful of it. And it's like, you know, like, so just to connect it to what we're talking about today is like, you know, I would say if it's affecting your happiness and your day to day and your ability to function, even, that is something to address. But, you know, as paramount over, you know, what everything looks like, you know, be making it, you know, really, really addressing it from a wellness perspective, right? So I guess that's my final thought. But what about you? I would like to know if you have any final thoughts, or if you have anything that you're like, "Ooh, no, like I really need to say this."
Okay. So I had mentioned that I brought the pelvis from my
Oh,
office.
yeah. Tell
Right. So
us.
I wanted,
Show us.
if that's okay, right? I wanted to
Yeah.
show people, this is like what I show people their first visit, and it's in my treatment room every single time. And I have it out purposely so people can be educated and learn about their body. So is that
Mm,
okay if I just like pull up this
absolutely.
pelvis? Okay. So, oh
I love
yeah,
that.
this is like the opposite. Okay. All right. So this is the pelvis. All right. So like a bunch of PTs name their pelvis. So this is Diana. I
Yes.
named her Diana. So
Hello, Diana.
I named her Diana after 2 things. So number 1, Wonder Woman, right? Her name is Diana. And number 2 is one of my grandmother's name is Diana, and she rocks. She rocks. She passed, but she's amazing. She's still with
Mm,
me. Okay,
mm.
so this is Diana's pelvis. Okay, so here we are from the front. Oh geez, this is like the opposite. So I'm
I know. I
so
know, it's so
sorry.
annoying.
All right, so right here is the pubic bone. Okay.
Mhm,
And here is the top part, the sides of the pelvis. So turning it around into the back, like this is the low back, the lumbar
mm.
spine and the sacrum. And then this is like the SI ligament, sacroiliac ligament. And then down here is the tailbone. Oh my gosh. Okay. All right. So now going under. Okay, we're going under the undercarriage.
Yeah.
Okay. So here is the bottom of the pelvic floor. Okay, this is a nerve. This is the pudendal nerve. All right, so from the bottom of the pubic bone attaches the outer part of the pelvic floor.
Mm,
Okay. So the muscles attached from the pubic bone to the both sit bones to all the way back here to the tailbone. So it's this whole massive area, right? So within that muscular area, we have the clitoris, the urethra, that's the hole where
mm,
the urine comes out, the vagina. This is that perineal body. That's a space where maybe sometimes gets torn or episiotomy. And then here's anus, right? So all these are the outer pelvic floor muscles. And these muscles have to be really smart. I mean, they have to be strong and flexible so that they know when to open and close, right? Or to be turned on or not to be turned on, right? So they also, right, if we were not even thinking about these muscles being part of your bladder, bowel, and sexual function, you would say, oh, it looks like these muscles hold together this bone and this bone. So they're completely orthopedic. Like when we think of stability of the pelvis, if we didn't have these muscles here, everything's coming down, right? Because you have
mhm.
this whole space. So these muscles are essential to our stability of our pelvis and our back, our sacrum, our tailbone. Like without these, what's going to happen? Okay. So then on the inside of the pelvis, let's go sideways, right? So first off, here's the hip socket. Okay. Then from the side view, we've got the bladder up in the front near the pubic bone, and then the uterus right here. And then sitting in the back, we've got the rectum. Okay. So that's inside of our pelvic bowl. All right. So if we take these out, and then we look inside the pelvis here without the organs, like look at this, all this red stuff, all the way in there, that's all these muscles, right? So this is the levator ani group. This one goes on the inside of the pubic bone all the way around to the back of the tailbone. There's that tailbone right here, right? And then like this is huge. And then these muscles here on the side are actually part of your hip, right? This is the obturator internus, and that also lines the pelvic floor. So these muscles have to be strong enough to hold, to hold the bones together, to open when you want them to and close when you don't want anything coming out. And they have to be able to help you or, gift you an orgasm. I mean, it's essential, And then this is just an example of one of the nerves. I made it with like a little thing
pipe
here.
cleaner from your kids'
pipe
craft.
Cleaner. Yeah, in one of the classes. But these nerves come out the sacrum there and come down to give sensation and function to like the clitoris and the vagina and the rectum. So anything can happen here. So these are essential. It's not just the vagina.
Yeah, I mean, I think it's so important. Thank you for showing us that, because I mean, not the average person isn't going to have a real grasp of the understanding that that is literally just all flesh beneath us and all muscle. There's no bone that's just like cradling everything. Yeah. So, when you push a 10-pound baby out, no, or you don't at all.
And any pound baby.
Yes, of course. It's going to be, regardless of what goes on, it's going to be affected. Yeah,
and the C-section scar sits right above the pubic bone, and what's right behind that pubic bone is the bladder, right? Mm-hmm. So you've got this bladder. Oh my gosh, I'm terrible with showing this here. So the bladder is sitting right behind the pubic bone. So when the bladder starts to fill, it moves upward and a little bit backward, and as it fills, the C-section scar has to be pliable enough to allow the bladder to fill. So if the scar in the C-section is really dense and not mobile, then it can limit the bladder from filling fully. And you might have this thing of urinary frequency with a C-section. And a lot of women with C-sections realize that it can happen. It doesn't happen to everybody, but it can happen. So, yeah.
That might be a thing. That's definitely a thing. I'm thinking, like I said, all the light bulbs are going on. But then again, when I met you,
that C-section scar tonight, Sam. I'm just gonna give it a little love.
I'm gonna give it some love. We're gonna meditate. We're gonna light a candle. We'll put some music on.
Mm-hmm. Yep.
But then again, I mean, admittedly, when I first met you, I was like, oh, and I definitely, wanted to talk with you more, and it took this long. But that's okay, because that's why I'm doing what I'm doing, because of course I have such interest in all of these different topics that it's like eventually there was going to be a way for me to get. So it's not just me that needs to hear this, it's everyone.
Yeah. Yeah. And like when I first started working with the pelvis internally in these muscles, I never went into PT thinking that I was going to do this. Like when I was in PT school, like it was beginning to be a thing in in our country for women's health, pelvic floor. And I was like, that is just strange. Like, that is not for me. Like, what? And then after I had my kids and during my education of the pelvic floor trainings, I was like, oh my God, like, why did it take me so long to get here? Like, obviously these muscles are huge and so important. And how did I miss this for so long? So like now that I've been working with this for a while, it just makes perfect sense. It makes complete perfect sense that these are so important.
Yeah. I mean, just coming back to how it's sort of this taboo. I mean, and thank you for sort of vulnerably admitting that, like, in the past you were like, I don't want nothing to do with that. I can't be working with that.
That's weird.
But I mean, you know, we can, I think it's productive to sort of laugh about it and just be like, okay, like, but we know why, you know, it's just like this, it's, but it is sad. It's like this area, this part of a woman's body that is quite arguably the most important thing in the entire universe.
Yes. Yes.
Because it creates life. It's part of the, you know, it's part of the system that creates life. Is just like crazy how little attention we pay to it because it's been made into an uncomfortable, taboo conversation to even talk about it, let alone work with it.
Yeah.
You know, in a platonic, like, just sort of business only type of way, you know, like, and not have it be like this thing. It's the same, you know, probably similar to like the breastfeeding conversation, right? Of just like, you know, can we just is that a word? Desexualize this.
Yes.
And
Yes.
look at it for what TF it is.
Yeah. Exactly.
We're talking about extremely important muscle groups here.
Yeah.
And then
like
we
where
can
else in the
actually,
body? Oh, I'm sorry. Like where
no,
else in the body would we not like follow like the most common like acute injury recipe, like rice, rest, ice, compression, elevation, right? So it's the same thing for the pelvis after birth, whether you have a C-section or a vaginal delivery. Like, why isn't this normal? It should be normal that everyone gets help here.
Yeah.
Hopefully it will be someday.
Yeah, we're getting there, and
Yeah.
you're a part of it. So thank you. Because I mean, and it's just so beautiful because I swear I've been starting to say this to almost every wellness practitioner or expert or entrepreneur or healer or whoever I'm talking to on this show. At the end, I'm always just like, thank you, because you're like saving the friggin' world, like one little bit at a time, right? Like, because if we can't find these ways to help each other heal, you know, we're going backwards, but you're pressing us forward. So thank you for doing what you do.
Thank you.
Seriously.
Thank you.
And thank you for joining me. And
Thank you
whether you're
me.
listening, yes, I mean, and happy birthday.
Oh, thank you.
And now you can go enjoy your birthday dinner. So if you're listening to this either live or after the fact and you liked this conversation, I will just put out there to please subscribe on YouTube to Self-Care is My Job YouTube channel, or you can follow on any podcast, podcast platform. Self-Care is My Job would be amazing. I believe you can write a review on Apple Podcasts. I'm hearing this, even though I'm not an Apple person, but that would be great too. And so we can get this conversation out there to be heard by the ears that need to hear it, because it's so important. And yeah, just a special shout out to the mommies who are listening to this. We're here for you. You don't have to do it alone. I have an upcoming, I even have an upcoming self-care for moms workshop that's starting on May 20th, just in case anybody wants to learn more. Reach out to me, because it's so important for us to kind of support each other as mothers. We're here trying to support everybody else, but we have to support each other and support ourselves as well. But yeah, that's my little spiel. And tell us real quick where we can find you online, and then I'll make sure to pop that into the caption as well.
Yeah, so I'm only on Facebook. So I'm on Facebook as Jennifer Collard Forns, PT, RYT 200. And then I'm currently practicing, well, I am a part of the team at Total Health Associates in Walbeck. So I'm on the Total Health Associates Facebook, Instagram. Yeah.
Right. Perfect. Okay, I'll pop that link in there too. It's perfect. Yay. Thank you so much, Jen. Again.
You're welcome. Thank you. Thank you.